I'm gonna get started in about 30 seconds. So hopefully some people will come on and we'll get it started. All right, I'm gonna keep it brief. So today I'm gonna talk about palpitations, and if anybody has any questions, they can ask or shoot me a message later on. But what exactly is palpitations? So these are sensation of irregularity within the heart, specifically the heartbeat. You can have palpitations and it's actually nothing. You can have palpitations and it's due to an arrhythmia, an abnormal heart rhythm. But those arrhythmias can be things like a PVC or a PAC. Those are extra beats that come from the bottom part of the heart and the top part of the heart, respectively. Are they life-threatening? No. Can they be very bothersome? Yes. They can make you feel uneasy. They can cause chest discomfort, sensation of skip beats. Sometimes people have issues with breathing that are associated with this. So yes, palpitations can be very uncomfortable. How do we treat it? Well, we want to make sure that you don't have any underlying issues in regards to your palpitations. We want to make sure that there's no symptoms, there's no issues with heart disease, issues with blockages in the heart arteries that can be potentially causing these palpitations. And how do we first work you up? We want to answer what exactly are your palpitations? Are they an abnormal sensation that you're feeling but everything is normal, or is there something that's really going on underlying? And we can do this in several ways. First step is an EKG, an electrocardiogram, to look at how well the heart is squeezing, but it also looks at what the underlying heart rhythm is. Issues with EKG is that it's real time and it's for, gives you a printout for about 7 to 10 seconds of a time period, versus people's palpitations can occur sporadically. So if I get an EKG and someone is having palpitations, but it's not showing what I want, I may do a longer monitor. And this monitor can be anything from 24 hours upwards to 30 days. And it can record it continuously. It can send us data continuously. And if you have those symptoms during that time period, you can actually push a button on the monitor and it'll send us more information about what's causing your palpitations. And if it's concerning enough, we can further investigate these palpitations with more testing, whether it's a stress test. We can get an echocardiogram, an ultrasound of your heart to see how well your heart's squeezing and if there's any underlying heart issues that can be causing these palpitations. If you have issues with your heart valve, specifically the aortic valve, once again, these palpitations can be an underlying meaning for something else, and we do our best to figure out what your something else is. Now, you've just been diagnosed with palpitations. What can you do for it? First thing you want to make sure is that we look at potential triggers of these palpitations. Things like excess caffeine can be cause of it. Things like those energy drinks that you were drinking can be a cause of it. You want to try to limit the amount of caffeine that you're taking in the forms of coffee, green tea, energy drinks, and whatnot. And some of carbonated beverages can be a significant cause of it too. If people are having frequent palpitations and they can't figure it out and we can't figure it out, one thing I always want people to also have is a journal. If they're having more palpitations on one day compared to a different day, then I want them to jot down, what did you eat, what is different from today compared to a previous day. And then from there you can figure out if your palpitations is something that's related to food or if it's deeper. And if your other things that can potentially cause these palpitations includes dehydration, issues with your electrolytes. So you want to make sure that that's being checked and that's corrected, especially potassium and magnesium. If those are poorly controlled, it can lead to irregularities within the heart itself. You want to look at how much stress that you're have. If you have a lot of stress, if you're not getting enough sleep, that can also cause significant palpitations. It says that I have two people on here, so if you guys can hear me, just shoot me a message, give me a 1, give me a 2, give me something that you guys can hear what I'm saying. I'm talking about palpitations, but open to answer any questions regarding the heart. Let me see if I can change. I want to say I'm answering questions about the heart. I don't know how to do this yet. Hopefully one day I'll figure this out. So if you guys have any questions regarding the heart health and prevention, let me know, and I'm going to do my best to answer those questions. But talking about palpitations and ways that you can diagnose it and ways that you can treat it. You can treat it by removing the excess things, caffeine, coffee, carbonated beverages. Certain foods can be big triggers for it. Getting enough sleep, following up with your primary care to get labs checked. And if you're still having palpitations despite all of this, we may consider medications, things like beta blockers, something like a metoprolol or a carvedilol, to help decrease the amounts of skip beats that you are having. Sometimes people can have underlying issues with, hormones or even, an underlying anxiety that can be a trigger for it. And if you don't treat those underlying psychosocial aspects, the palpitations will continue to ensue. But ways that we can treat it are things like beta blockers, metoprolol, calcium channel blockers such as amlodipine. There are some stronger medications, but those are also associated with some side effects with it. So we want to be very careful in selecting those medications. I think that's the most that I can talk about regarding palpitations, unless anybody has any questions. All right, I just finished talking about palpitations, and the next topic is going to be about blood pressure. And the reason that blood pressure is extremely important is because high blood pressure is one of the biggest markers, one of the biggest risk factors when it comes to heart disease, when it comes to treating this for prevention, when it comes to things like heart attacks, heart failure, strokes, kidney failure, needing dialysis. So we really want to control that blood pressure to the best of our abilities. There are certain guidelines that we want to shoot for. There are certain numbers that we want to shoot for, but we also have to keep in mind that certain individuals, if you try to shoot for those numbers, may make them feel more dizzy. Even though you're protecting them from having a stroke, you are increasing the risk of them potentially having episodes such as fainting spells. So what is considered a normal blood pressure? You want the top number to be 120 or less, and the bottom number to be 80 or less. Pre-hypertension is 121 to 129, 80 to 89. Stage 1 hypertension, 130 to 139. On the bottom number, I guess that's 90 to 99. And stage 2 hypertension, it is 140 and above, and bottom number, I guess that's 189, 100 or above. Having some difficulties with my numbers, but depending on where you are, the first thing we want to do is looking for ways that we can treat this naturally without any medication. So you want to look at things like exercise and getting, that 150 minutes of moderate intensity activity each and every week, or 75 minutes of high intensity exercising activities each and every week. You want to be consistent with this. This also comes with weight loss, and the more weight you lose, the more chance you have of decreasing your systolic blood pressure and increasing the chances of getting that number down to goal. Exercise, weight loss, you want to watch what you're eating, nutrition, the DASH diet, dietary approach to stop hypertension, focusing on fruits, plants, lean proteins, fish, checking once to remove away from processed foods as much as possible, remove away from excessive red meats as possible. So exercise, nutrition, weight loss, stress management. You want to check electrolytes to make sure that your potassium is normal, your magnesium is normal. You want to look for underlying issues that can be causing these blood pressure, things like sleep apnea, one of the biggest and most um, um, commonly not treated or underdiagnosed. You want to look for other things like renal artery stenosis, fibroblascular dysplasia, issues with the hormones. People who are menopausal or perimenopausal can have differences in their blood pressure, so you want to take that into account too. And if you've done all of those things and you're still not, don't have your blood pressure at goal, then you want to look at possibly starting people on medications to treat this blood pressure. You can start them off with things like a calcium channel blocker like amlodipine, thiazide like hydrochlorothiazide, um, ACE inhibitors like cinepril, benazepril, aldosterone receptor blockers, losartan. So there's a lot of different medications that you can use for each individual. The biggest thing is to use the medication that causes the least amount of side effects per individual. So if someone has some leg swelling, you want to stay away from a calcium channel blocker because one of the biggest side effects is ankle swelling. If someone has issues with potassium being too high, then you want to stay away from ACE inhibitors because those can cause elevated potassium levels. So that's pretty much, the gram screen, the smidget on palpitations and blood pressure. I'm just going to leave this opportunity for the next 2 minutes to try to answer as many questions as possible if anybody has any. If not, that's all right. I'll pop back on tomorrow to probably talk about the same things until get a little bit more traction from time to time on this live version. So anybody have any questions before I get off? It's starting to pop a little bit. I see 6 now. So if people who are just joining, my name is Dr. Isang. I'm a cardiologist. I was just talking about certain things in prevention, specifically hypertension, but also talked about palpitations and what they can be, how we evaluate them with an EKG or a 3-day monitor, upwards to a 30-day monitor. Triggers including excess caffeine, stress, electrolytes, and treatments with removing those triggers and potentially putting people on beta blockers if their symptoms remain uncontrolled. So I'm going to give it 1 more minute to try to answer any question as possible if you guys want. Last chance, this is Dr. Isang here to answer any questions. If you guys have any questions, let me know. Unless within the next 30 seconds to 1 minute, I'll be out. All right, this was a good attempt. I'll be back on tomorrow, probably around the same time. Dr. Isang, cardiologist. Talk to you guys later.